better be sure that this is what you want to do. You can't get through this and a few years into your residency decide, I don't think medicine's for me, because you've already gone down a bad road. So just make sure you're looking at that. And I guess since I didn't realize I'd been going that long, I'm sorry.
No, interesting.
Yes, ma'am.
What do you think about offshore international medical schools? Not money-wise, just in general.
Our most recent partner went to a foreign medical school. I think you can look at it different ways. To me, she kept pushing and got into medical school. She did what she had to get here. She persevered, she worked. And then at the end of it, we all take the same standardized test to pass the board certification or not. Got into a good residency program by doing that. And at this point, we don't really care where she went to medical school, we care where she did residency.
But is it harder to get into residency programs
in
the United States?
It is harder to get into residency programs, into good programs, if you do that. Mm-hmm. But it's possible. You have to get there and work your butt off. Any questions about anything?
I got one actually. What sort of things, like what would be like your daily life? I know it kind of alters and stuff, but like when you go and to work and stuff, like what kind of hours are you putting in and stuff like that as an OBGYN?
Most days start start in the OR. If I'm in the OR, those days usually start at 7:15. I go till usually about probably pushing 6 o'clock most days. We have Friday afternoons off, so I've got a 2-day weekend every week that I'm not on call. Some of my partners take Friday off. One of them takes Monday off. Her husband is an attorney, and a lot of his work is out of town, so she takes Monday off and he takes Friday off, so that they've got more time with the kids. Basically, 7:30 to about 6, Monday through Thursday. I'm usually out by 12:30, 1 o'clock on Friday. Because there are now 8 of us in our call rotation, pretty sweet. I work 1 out of 8 weekends. Every other month I work a weekend. And then, Monday through Friday I'm doing, 1 out of 8 days on call. That's ridiculous. It's when we're on call, we're busy, we're working. We stay in the hospital 24/7. So, and with what I do with OBGYN, things can happen and change so quickly. You can go from having nobody in labor to somebody rolling in with an abruption, and if you're not there to take care of it, you've got a dead baby. So we do it that way. Everybody in town doesn't do that. Operate probably 3 days a week if I'm not on call.
So back to when you were talking about the shadowing of doctors, do you think that it's the same thing, I guess, if you volunteer at a hospital, or is it like mandatory that it be more shadowing?
I think the volunteering is good, but are you getting in to really see what the day-to-day life is? Are you getting to talk to the doctor and pick their brain about what they're doing, why they're doing it? I think you need to do the shadowing too.
Okay.
What are the best and worst parts about OBGYN?
Worst part, no doubt. When something bad happens, I was on call Thursday. One of my partners had seen this patient the day before, 38 weeks pregnant, and had no risk factors for any problems whatsoever. Came in and had a dead baby. I delivered her the next morning. She had a true knot in the umbilical cord that had, of course, usually handles just about anything thrown at it, but baby had flip-flopped and gone through, and there was a true knot in the cord that had gotten tightened, and baby died. So seeing things that you have no control over, that you can't fix, that are that devastating, that's the absolutely worst part of what I do. But it's probably more important what I do for that woman and her family than the normal routine. Comes in, everything goes smoothly normally, and baby all but delivers itself, and they don't really need me probably. Okay, that's the worst part of it. What was the other part of your question?
What was the best part?
Best part. I have delivered now. I've been keeping track since I started medical school. I'm sure I'm really right. All right, y'all gonna love this.
You haven't missed any?
Got them all. 9,343 babies. Isn't that crazy?
About 4,000 soon.
Think about it. Think about that. 9,343 human lives. And there's a mom, not always mom and dad there, but family there with them with that too. The people I've touched, I grew up in this community. My dad had a restaurant in Casey. That population paid for me to go to med school, and now I'm back working in that community, taking care of those people. That's pretty cool.
Any last minute questions, guys?
If anybody has need of help getting into shadow, Dr. Handy can get you in touch with me. Yes, sir.
On average, how many babies do you deliver a week-ish? I know you said it varies. So I'm just
Yeah, we deliver, as a group, we deliver about 2,000 babies a year. So on average, 180 to 200 a month. So, 6 a day, roughly.
When a baby dies under your watch, what do you say to that family? Because I know sometimes shadowing experience that's not exactly what you bring a shadow into. So just what do you?
Well, it depends on the other things. About 20% of pregnancies end up in miscarriage in the first trimester. So we see that all the time. That's hard. It's not nearly as hard as it is when it's at the end of the pregnancy. When something, especially if you've got a baby that mom's sick, baby's sick, and things go south at the end of the pregnancy. You'll go through, if you guys end up going down this road, you're almost certainly going to go through a lawsuit at some point. You're going to be sued. Somebody's going to tell you you did something wrong, you weren't good enough, you're going to be there. If you go into OBGYN, you're going to be sued. I've been involved with 3 lawsuits in my career. First one was a patient that had an epidural abscess. I happened to be the doctor on call when she started having problems. I didn't deliver her, didn't do her C-section, didn't do the epidural. I happened to be the one I was on call when she first had a low-grade fever and made the diagnosis. I got the neurosurgeon involved and the infectious disease specialist involved, osteoplastic. I've taken care of her for a number of years at that point. Took it very personally. Fortunately, the case was dropped. I was dropped from the case, I guess I should say. That was hard. That was really hard. The second case, and one of my partners told me then, he said, look, if you can't deal with this, you need to find something else to do because you're going to get sued again. The second one was a patient that one of our midwives, we have a group of midwives that they work as a separate practice, provide that service, but with us as their backup and supervisors. So midwife patient who went to my church. I happened to be walking through labor and delivery at 1 o'clock in the morning, checked on another patient and saw that she had a temp that had gone up to 100.2. So looked at it, gave me the order for antibiotics. The next morning, temperature came down, doing fine. The next morning she was delivered and baby died of overwhelming root B strep sepsis. culture showed that the antibiotic I started her on covered it, was appropriate. Root strep is bad, and it's not a thing we could have done about that. The midwife that was involved almost quit practicing after that. And fortunately, after going through depositions, cases dropped. That's, I guess, the other worst part of this. Okay, but that's reality of where we live. You're going to get sued. So if you can handle that, that's just part of it. It's part of what we do. If you can't handle that, you need to think about doing something else.
I guess with that, just a real quick question. OBGYN, I mean, probably has some of the highest malpractice. What are the other ones in line, or maybe there's more above?
Neurosurgery is bad, orthopedics is bad. Surgical specialties in general are bad. Something that is going to have profound impact, clearly with us. You got a baby, you have a baby in front of the jury for a loss, it's going to be a lot of money. In most states, the biggest jury verdicts ever are OB/GYN related. You just do the best you can. You try to do the right thing when you're there, and this is challenge all of you. I remember when I was a resident, the guy that was here ahead of me, anytime I would ask him a question about something, a clinical decision, he would turn it right back on me and said, well, what do you think you should do? And his response was always, all right, you know what to do the right thing. And if you do that, as you're going through, if you do the right thing and make your best decision, you're going to do okay. You'll be wrong sometimes. Just do the best you can. All right. Thanks, guys.
Thank you so much. Yeah.
Thank you, Dr. Estes. We really appreciate it. Thanks, Dr. Haynes, for sticking around and coming. If you want to talk to them real quick before they head out, if you have any last questions, feel free to do so. Before you head out, please grab some food as you go, and good luck on finals, and we'll see you in the spring. Thank you all so much.
Happy Christmas.